Hi, let's talk about nurses documentation. This is a very key, very important part of nursing. So your documentation, what it does is that it tells a story of how your shift went. It paints a picture of what you did with your patient, what you did for your patient, and it serves as a record and as evidence of what you did during your shift. So you want to make it a good one. So the electronic health records have softwares that nurses use to document what went on in their shifts. So these softwares, there are different types. There's a video where I talked about the different types of softwares. There are different types. So some of them are more detailed than the others. They differ depending on the kind of unit or facility or setting you're working with. So whatever it is, whatever type that you're eventually going to work with, familiarize yourself with it, which during your orientation you'll be shown how to use it. So, but what I'm not going to focus on different types. I'm just going to focus on the main thing a nurse is supposed to document. It's not going to be the same for every setting, but at least there are some key things that you usually, find in each of these software or in each of these records that you are supposed to make or keep for your patient. So even though there are different approaches, there are basic things you should do. So I'm going to go over those basic things. But before I do that, I want to emphasize on what I mean by telling a story about what went on during your shift. So document in such a way that even when you are not there, your documentation can tell any average person who reads through it that this is what you did. And document in such a way that your documentation can stand up in a court of law or stand up anywhere. Because something you documented 5 years ago, you might be called upon, if maybe that patient gets in a lawsuit or whatever, you might be called upon 5 years later when you've completely forgotten that anything like that happened. Document in such a way that documentation will bring out a clear picture of what you did. Do not leave any gaps. Do not leave any gray areas. Make sure that everything comes out very clearly. So that's the major thing about the documentation. Another thing is that whatever it is you do for your patient, if you like, jump up and down, come down, go sideways, whatever it is you do, even if you healed the patient, let me go that way, and you don't document it, you did not do it. So make sure that everything you did was documented. If the vitals at some point in your shift show that maybe the vitals are too low or too high, make sure that there is a response to that within the shift. That is what I mean, is that make sure that for maybe high blood pressure, you document somewhere that this is what you did. Either you notified the provider or you gave the patient medication according to the order that is in the patient's chart. So make sure that everything that happens to a patient, there is a response to it. If maybe the patient had pain during your shift, you assess the patient has pain, make sure that you gave a pain med and you reassessed all of those things documented. If maybe there is a medication that the patient should get, and you gave that medication and there was some kind of effect, whether it's adverse effect or whatever, make sure that you document a response, either that you notify the provider or you did this, whatever it is. Don't leave anything, with a question mark. For instance, if you document somewhere that the patient has a 9 out of 10 pain, and then there's nothing to show that you did anything about the pain, either treat with pain med as ordered, or notify a provider or something. So that's what I'm trying to say by painting a picture. If maybe your patient is on telemetry and the patient gets a leader rhythm, you know, a rhythm that is not normal, don't leave it like that. Document that the patient had so rhythm at so time, the patient had symptoms or did not have symptoms, and then you notify the provider. So let there be a whole story of what happened in your shift. That's what I mean by that. Now let's go over the basic things that you should do. Of course, you should assess your patient head to toe. Assess your patient when you come on shift. This is how you met the patient. It shows how you met the patient. That initial assessment, how you met the patient, so that if anything changes during the shift, you can say, okay, at the beginning of the shift, I assessed this patient, the abdomen was not distended, but at this time it's distended. So you can tell that this may have changed in the patient. So that's why you do your assessment. So in the software, the electronic health records software, there is a place for you to do your assessment. It's like filling out a form. They will start from the head. You fill out all that it applies to the patient. Is the patient alert and oriented? Is a patient dizzy? You know, different things that has to do with that aspect of the patient's body will be on that form. So you just fill it out. You move to the cardiovascular system. They'll ask about you listen to the chest. Does it have heart sound? How is the heart sound? You know, all those things you do during assessment. Everything, you fill it out there. Then another major thing you will do across all the settings is giving of medication. So there's also a template on the software where you will scan the medication you gave to the patient. So that one will show that you gave so patient so medication at so time. So that's your evidence that you gave the patient medication, because some of the patients can deny that you didn't give them medication, especially when it has to do with narcotics. Some patients can deny that you didn't give them, but that scanning on the electronic health record will vindicate you that you gave the patient at this time, you gave so medication at this time. Then some medications are time critical, so you should give them at a certain time, maybe like insulin and some other medications. So that will also be your evidence that you gave the patient the medication at so time, because it has a time stamp. So that's it for medications. Then there is a list of tasks you should do for the patient. Maybe you have to turn the patient every 2 hours. You have to do wound care. You have to check blood pressure. You know, so many things that may be specific to a patient that you should do per shift. It's just like a list of tasks. So there's a template again that will help you check off all those tasks. You did this, you did this, you did this at this time. So that's another common one. Then I's and O's. That's intake and output. Whatever the patient took in, whether it's tube feeds or their dinner or their lunch, or they drank, whatever they drank, whatever it is the patient takes in short, you document it. Whatever the patient takes out, whether it's stool, urine, whatever, you document it. So that's where the I and O templates come in. That's what you do on that. Then the care plan. The nurse's care plan. Thankfully, some of these electronic records or softwares, they suggest, they pull data from the patient's information and give suggestions of what the care plan of such a patient may be. Then you can select it and check it off. Okay, this patient, he needs to You need to watch their oxygen because they are COPD, or this patient needs to be watched because they are high risk, high fall risk, different things you do in the care plan. So it will actually suggest the care plan to you. Then you choose which one you want to do for the patient. You check that off too. And that's evidence that you have a care plan for the patient. Then there are other templates like nursing procedure. Maybe you put a Foley in, you put a PIV in, maybe you did wound care. Everything you did for the patient, there's a place you fill it out. Blood transfusion, you fill it out that this you did for this for the patient at so time. So those are the major things there. And then there is a template for notes where if anything else outside the ordinary happened to the patient that you don't have a template to put that in, you can write a note that this happened, patient called you at this time, patient said he feels like vomiting, you did this, you did that. You put it in form of a note so that there is a complete summary of what happened during that shift. So that's what you do with the notes templates. Then I want to bring up some random things. Copying and pasting. I will discourage you from copying other people's assessments. Don't copy other people's assessment. If you must copy it, make sure you go through each of the items to see that it matches with what is current for the patient at that time. There are two reasons why you shouldn't copy and paste. Number one, the person who did the assessment before you, who you are copying from, may have written a wrong information. When you copy that wrong information. Another thing is that the information in the previous assessment may not be updated, may be old information. For instance, if the patient was in pain at that time and this time is not in pain, and you copy and paste, you are saying the patient is in pain and you didn't do anything about it. So that's another reason. Try to do your own assessment. Sometimes it's crazy busy, but try your best to make sure that you do your own assessment, or if you are copying, make sure that what you are copying matches with what is current for the patient. Then there are some sensitive areas you should not play with. Areas that has to do with pressure injury, infections that the patient came with or the patient developed in the hospital, pain assessment, fall risks, restraints, and narcotics. Narcotics, don't play with it. Make sure that you put the right documentation there. Then make sure you use approved abbreviations or acronyms. Don't just use any random thing. Check with your facility what acronyms or abbreviations do they allow. Then you use that. Don't just formulate your own and use it. Then as much as possible, document in real time. As whatever is happening, be documenting. Don't wait for 3-4 hours. If you can help it, there are times you cannot help it. If you can help it, document as soon as possible. Then there are times you get verbal orders from doctors. Make sure you document it, because a doctor can give you a verbal order and it's not documented anywhere, and then you'll be called to ask, why did you do this? Especially if it has to do with drugs of control, narcotics. Whatever the doctor tells you verbally, if it's an order, go and document. There is a template for that to document that so doctor said to give so thing to so patient at so time, to cover yourself. So those are the major things. Thanks for listening. Make sure to like, share, subscribe, and follow for more.